All right, let's dive deep today into the world of systemic therapies.
That's good.
This is a fascinating area.
Yeah.
It kind of shifts the focus from just you as an individual to you as part of a larger system,
Right.
and mainly your family system.
Yeah.
It's kind of like, those old domino rallies
Mm-hmm.
where one tiny push can set off a whole chain reaction,
Totally. Yeah.
and that's kind of how families work according to these therapies.
Yeah, it's really fascinating how these therapies kind of emerged from a real shift in scientific thinking back in the 50s and 60s.
Okay.
Instead of breaking things down to their smallest parts, scientists started looking at how those parts interacted as a whole. And this led to things like general systems theory and cybernetics.
Right.
And systemic therapies applied the same thinking to families,
Yeah.
recognizing them as complex, interconnected systems.
So it's not just about understanding each individual family member,
Right.
but about seeing how they all influence each other in this sort of intricate dance of relationships.
Exactly. And that brings us to one of the most important concepts in systemic therapy,
Okay.
which is wholeness.
Okay.
So a family isn't just a collection of individuals. It's the unique way they interact that creates something entirely new.
Okay.
Like imagine a sports team.
Okay.
You could have the most talented players in the world, but if they don't work together effectively, they won't win.
Right.
The same applies to families.
So it's not just about mom's personality plus dad's personality,
Right.
but about the invisible bonds, the power dynamics, the unspoken rules that make each family its own unique system.
Right. And speaking of rules, that leads us to another key concept, boundaries.
Okay.
Just like countries have borders, families have boundaries that define how members interact.
Right.
These can be physical, like knocking before entering someone's room,
Uh-huh.
or emotional, like how much personal information is shared.
And these boundaries can be either permeable,
Right.
allowing for a lot of flow between family members, or rigid, keeping people more separate and independent.
Exactly.
I imagine finding the right balance is crucial.
Absolutely too permeable. And you might see enmeshment,
Okay.
where individuals kind of lose their sense of self, too rigid, and you get disengagement,
Right.
where family members feel isolated.
So it's finding that sort of happy medium.
Exactly.
Yeah.
The key takeaway here is that healthy boundaries are essential for a family to function well.
And I think it's a good point to even pause for a second and think about your own family.
Totally.
Where do you see healthy boundaries, and where might things be a little too open or closed off? I
Absolutely.
mean, that's an interesting point to ponder.
Yeah.
For sure.
Yeah, for sure.
And of course, we can't forget about hierarchy. I mean, every family has some sort of pecking order, right?
Yes, and healthy hierarchies provide structure and stability. However, they can become distorted,
Okay.
leading to power struggles and imbalances.
Got it.
It's like a company where the boss micromanages everything.
Right.
Nothing gets done efficiently.
Yeah.
Everyone feels stifled.
Okay, so we've got wholeness, boundaries, and hierarchy.
Right.
Starting to see how these concepts work together, but systems also strive for balance or homeostasis, right?
Precisely when something disrupts that balance, the system tries to adjust.
Okay.
Sometimes in ways that seem counterintuitive, even dysfunctional.
Okay.
Think of it like a thermostat.
Okay.
When the temperature drops,
Oh, yeah.
the heater kicks in to maintain a comfortable environment.
Right.
Families do the same thing, but their thermostats are a bit more complex.
Now, I'm really curious to see how these concepts play out in different types of therapy.
Right.
What about communication or strategic therapy?
Okay.
I remember reading about those intriguing figures like Bates and Haley and Satir.
Yeah, they were pioneers
Okay.
in focusing on communication patterns as the key to understanding and changing family dynamics.
Okay.
And they saw psychopathology not as an individual problem, but as a symptom of dysfunctional communication within the family.
So instead of just focusing on what people said they were interested in how they said it, the unspoken messages, the double meanings,
Exactly.
it's almost like they were deciphering a secret family language.
Exactly. They saw how confusing or contradictory messages could create a double bind, leaving someone feeling trapped and unsure how to respond.
Wow.
A classic example is the mother who tells her son she loves him while pushing him away.
Oh.
Her words say one thing,
Uh-huh.
but her actions convey the opposite.
That reminds me of something in our research about the 5 axioms of communication.
Right.
These axioms kind of emphasize how communication is always doing more than one thing at once. For example, every message has a report, which is the literal content, and a command, which defines the relationship.
Right.
So if I say, take out the trash, It's not just about the trash.
Exactly.
It's also communicating something about my expectations at our roles.
Yes, and if those two levels don't align, like if I yell, "I love you,"
Right. So
that's when problems can arise. Interesting.
one of the key figures in this area, Virginia Satter, focused on helping families communicate more congruently,
Okay.
where words and feelings match.
Yeah.
Imagine if you could consistently and clearly express your needs and emotions to your family.
Right.
How do you think that would impact your relationships?
It would certainly reduce a lot of misunderstanding and frustration, for sure.
Totally. But what about the actual techniques they used in therapy?
Right, because I'm curious about this idea of reframing.
Okay, so reframing is all about shifting perspective.
Okay.
Instead of seeing a child's tantrums as bad behavior, you might reframe them as attempts to communicate unmet needs or lack of control.
Interesting.
Imagine if you could find a more positive or empathetic interpretation for a challenging situation in your own family.
Yeah.
How might that change how you react?
It's a great question to consider. I mean, it seems like a simple shift in perspective can have a huge impact.
Absolutely. Another technique, though controversial, is prescribing the symptom.
This involves strategically encouraging the client to engage in the very behavior they want to stop.
Oh, wow.
It sounds counterintuitive,
Yeah.
but sometimes by consciously choosing to do something, you gain a sense of control over it and even recognize its absurdity.
It's like saying, all right, anxiety, you want to take over? Let's see what you've got.
Exactly.
It's a way of turning the tables on the problem.
Exactly. And then there are therapeutic double binds, which use the same concept as those problematic double binds we discussed earlier. But this time they're used to promote positive change.
Got it.
The therapist might create a situation where no matter what the client does, they're moving towards a healthier outcome.
Okay.
Imagine telling a couple who constantly argues to try to argue even more that week.
Oh, I see what you mean.
Right.
It forces them to either follow the directive and realize how absurd it is, or find new ways to communicate that don't involve arguing.
Exactly.
It's like a sneaky way of nudging them toward positive change.
Yeah, right. And speaking of sneaky, another key figure, Jay Haley, took this strategic approach even further,
Okay.
focusing on power dynamics within families.
Okay.
He believed therapists shouldn't shy away from being directive, even using techniques like ordeal therapy,
Okay.
where the treatment is intentionally made more unpleasant than the symptom itself to motivate change.
Ordeal therapy. Wow, that sounds intense.
Yeah.
Almost like facing your fear head on.
It's definitely not for everyone, and it requires a lot of skill on the part of the therapist.
Right.
But the key takeaway is that these early pioneers were really pushing boundaries and thinking outside the box when it came to helping families change.
It's remarkable how creative they were. But before we move on to other approaches, tell me more about structural therapy,
Okay.
which I associate with Salvador Minuchin.
Yes.
It seems like he took a more hands-on approach.
Minuchin was all about the structure of the family system, how the pieces fit together.
Okay.
He believed that healthy families have clear boundaries, defined hierarchies, and the flexibility to adapt.
Got it.
He often used visual metaphors like describing families as rooms with walls and doorways to represent their boundaries.
So it's like he was looking at the family's blueprint, the architecture of their relationship.
Precisely. And he contrasted healthy families with two dysfunctional types.
Okay.
Disengaged families with rigid boundaries think isolated rooms with thick walls.
Yeah.
And enmeshed families with overly permeable boundaries, like a house with no walls at all.
I'm starting to see how these metaphors can make those complex concepts easier to grasp.
Right.
And I've heard that Minuchin was known for being very active and directive in therapy, almost like a stage director, guiding the family through a performance.
He was indeed. He used techniques like joining, where he'd immerse himself in the family's world, speaking their language, understanding their dynamics. From that position of trust, he'd start to challenge their dysfunctional patterns.
So not just observing from the sidelines, but jumping right into the family huddle.
Exactly. He was famous for techniques like boundary making, where he'd physically position family members differently in the room to create healthier boundaries.
Okay.
He was also a master of enactments, encouraging families to role-play their conflicts right there in the session.
Wow.
Imagine the insights that could come from watching a family literally act out their struggles.
That's taking show don't tell to a whole new level.
Yeah.
It's amazing how he blended this deep understanding of family dynamics with a very hands-on, almost theatrical approach.
Mnuchin believed that by experiencing those patterns in a new way, families could start to shift them. But before we dive into other therapies, we need to explore another major figure, Murray Bowen.
Okay.
And his Bowen Family Systems Therapy.
I'm particularly intrigued by Bowen's focus on multi-generational patterns.
Yes.
The idea that families carry legacies that can echo across generations, it almost makes you wonder how much of our current struggles are rooted in our family's past.
That's exactly what Bowen was interested in.
Wow.
He believed that to truly understand an individual, you had to look at their family history, going back several generations.
Okay.
He was particularly fascinated by the concept of differentiation of self.
Okay.
The ability to separate your own thoughts and feelings from those of your family.
So it's about developing that sense of individuality, being able to think for yourself and make your own choices, even if they differ from your family's expectations. I imagine that's crucial for anyone.
Absolutely.
But especially for people who feel overly entangled in their family's dynamics.
Bowen saw a lack of differentiation, what he called fusion, as the root of many psychological problems.
Okay.
When you're too emotionally fused with your family, you're easily swept up in their anxieties, their conflicts, their patterns.
Yeah.
It's like you're still operating on a we mindset rather than an I mindset.
And that's where his idea of triangulation comes in, right?
Yes.
I remember the example of parents in conflict focusing all their attention on a problem child to avoid dealing with their own issues.
That's a classic example.
Yeah.
And that child gets caught in the triangle, often becoming a scapegoat for the family's problems. The key takeaway is that when a two-person relationship can't handle tension, they often pull in a third person to stabilize things.
It's a dynamic that plays out in so many different relationships.
Yes.
Not just families. And Bowen believed these triangles could even span generations, passing those patterns of fusion and triangulation down the family line.
That's his multi-generational transmission process. Think of it like a ripple effect.
Okay.
A pattern that starts generations ago can still be influencing how family members relate to each other today.
It makes you realize that sometimes those seemingly individual problems are actually echoes of long-standing family dynamics.
Exactly.
So if you're constantly feeling anxious or overwhelmed, maybe it's worth taking a look at your family history.
Yes.
To see if there are any patterns that might be contributing. It's like having a hidden family script that you're unconsciously following.
And Bowenian therapy is all about becoming aware of that script and then rewriting it. It's about helping individuals differentiate themselves, developing that I position that lets them make choices that are truly in their own best interests.
So instead of blaming your past, it's about understanding those patterns and then consciously choosing how you want to relate to them.
Exactly.
This has given me a whole new perspective on family dynamics, and I'm curious to learn more about the tools they used, like the genogram. I imagine that could be pretty eye-opening.
It's like a family tree, but with all the emotional baggage included.
Oh, wow.
It helps visualize those relationships, conflicts, and patterns across generations. Seeing it laid out like that can be incredibly powerful for understanding how your own story fits into the larger family narrative. But we've also got to talk about a more recent wave of therapies, evidence-based family therapies.
Okay.
Like multisystemic therapy or MST.
Right, and I'm really curious about this because they seem to combine the richness of systemic thinking with the rigor of scientific research.
That's exactly what they're all about.
Yeah.
These therapies have emerged from carefully controlled studies that demonstrate their effectiveness in treating specific problems.
Got it.
They're not just based on clinical intuition. They've been put to the test and shown to produce real results.
That's reassuring to hear, especially when dealing with complex issues. It's good to know that there are therapies that have been scientifically validated.
And MST in particular has been incredibly successful in treating serious issues in youth like conduct disorders and substance abuse.
Okay.
It takes a very intensive, multi-pronged approach that addresses the entire system surrounding the young person.
So it's not just about working with the individual, but also with their family, their school, their community, anyone who might be contributing to the problem or could be part of the solution.
Exactly.
It's like a whole team rallying around the young person to support positive change.
Exactly. MST therapists go where the family is. They meet frequently. They're available 24/7.
Wow.
It's a very hands-on approach focused on building on the family's strengths and empowering them to create their own solutions.
It sounds like a very collaborative and empowering approach. And I remember reading about their unique strategies for engaging families who have been labeled as resistant or difficult.
They use what they call the 5 Ps: practical, positive, planned, personalized, and paced.
Okay.
These principles help engage families by offering practical help, focusing on strength, creating a clear plan, tailoring the approach to their needs, and moving at a pace that feels comfortable.
Those P's sound like a great recipe for building trust and rapport with any family, not just those who have been resistant to therapy in the past.
And the research really backs that up. The findings on MST's effectiveness, especially with juvenile offenders, are truly impressive.
Wow.
There was one 20-year follow-up study that showed dramatic reductions in recidivism, meaning these young people were far less likely to reoffend after going through MST.
That's incredible.
Yeah.
It shows how powerful it can be to take a systemic approach addressing not just the individual, but the entire web of influences that contribute to their behavior.
And while MST is specifically designed for you, I think those 5 Ps offer valuable insights for anyone working with families, even in less formal settings.
Okay.
Think about it. How could you apply those principles in your own interactions with your family?
Yeah.
Could focusing on the positive, being more practical, or personalizing your approach help strengthen your relationships?
Those are great questions to ponder. It's like MST is giving us a roadmap for more effective communication and problem solving within families.
And that's just one example of how evidence-based family therapies are pushing the field forward.
Right.
Combining the best of both worlds, the rigor of scientific research with the nuanced understanding of family dynamics.
I'm so glad we're exploring this side of systemic therapies because it really highlights their potential for creating real and lasting change.
Absolutely.
But before we wrap up this part of our deep dive, I want to make sure we address the effectiveness of systemic therapies as a whole. What does the research say about their overall impact?
The good news is that there's been a lot of research on this.
Okay.
And the findings are quite encouraging.
Oh.
Numerous meta-analyses, which combine data from many different studies, have shown that couple and family therapy are, on average, significantly more effective than no treatment at all.
So it's not just a matter of feeling better because you're talking to someone.
Right.
There's actual evidence that these therapies can lead to meaningful and lasting change.
And the average effect sizes are quite impressive, indicating that systemic therapies are not only effective, but also efficient.
Right.
We see particularly strong evidence for their effectiveness in treating a range of disorders, including depression, anxiety, substance abuse, eating disorders, and relationship problems.
It's almost like these therapies are expanding the definition of what's possible.
Yes.
They're saying that we don't have to limit ourselves to just treating individual symptoms.
Right.
We can actually address the root causes of those symptoms by working with the entire system.
Exactly. And that shift in perspective has the potential to create truly transformative change, not just for the individual, but for their families and communities as well.
This has been such a mind-expanding exploration.
Yeah.
We've covered so much ground already,
know.
from foundational concepts to specific approaches and the research that supports them.
It's a lot to take in.
It is. And in part 2, we'll delve into some of the criticisms of systemic therapies.
Okay.
Because as with any approach, it's important to consider the different perspectives and controversies they've sparked over the years.
Absolutely.
But for now, we'll leave you with this thought as you go about your day. Try to notice the systems in your own life. How do they influence your thoughts, feelings, and behaviors?
Good question.
What patterns do you see, and how might a systemic perspective help you navigate those complexities?
We'll be back with more insights in part 2, so stay tuned.
All right, see you then. Welcome back, fellow deep divers. I'm still processing all those systemic insights from part 1, but as you know, no approach is perfect, and it's time to get a little critical. What are some of the downsides to these therapies?
Yeah, it's important to acknowledge that systemic therapies have faced their fair share of criticism over the years. You know, just like those family sisters we've been talking about, the field of therapy itself has its own dynamics with different perspectives vying for influence. One of the loudest voices came from the psychoanalytic camp. Remember, they place a huge emphasis on the individual unconscious, and they weren't too thrilled about this idea of the family system taking center stage.
I can imagine them scoffing at the idea of family dynamics being more important than those deep-seated unconscious drives. It's all about childhood trauma, they'd say, not your squabbles over the dishes.
Exactly. Their main critique was that systemic therapies kind of oversimplified things. They felt that focusing solely on family interactions ignored the depth and complexity of individual psychology.
So they saw it as kind of a superficial approach, not digging deep enough to uncover those underlying issues that psychoanalysis is famous for. It's like trying to understand a complex novel by only reading the dialogue. You're missing out on the rich inner world of the characters.
Right. And they also pointed out that not everyone lives in a traditional family system. What about people who are estranged from their families or who live alone? How do you apply these principles if there's no family system to observe or restructure?
That's a valid point. It seems like those individual contexts would require a more tailored approach, maybe borrowing from systemic principles, but adapting them to fit the individual situation.
Precisely. And then you have the cognitive behavioral perspective, which, as you might guess, had its own set of concerns. Remember, CBT is all about the here and now identifying unhelpful thought patterns and behaviors that maintain problems. They felt like systemic therapies were too focused on the past, especially Bowen's work with multi-generational patterns.
So while I might be obsessing over a fight with my partner today, a Bowenian therapist might be asking me about my grandmother's relationship with her mother-in-law. And sometimes I just need to learn how to stop those negative thought loops now, not uncover family secrets from 50 years ago.
Right. They argued that constantly digging up the past could be counterproductive, keeping people stuck in a victim mentality. It's like saying, well, my parents messed me up, so I guess I'm doomed. Instead of focusing on how those past experiences might still be shaping your thoughts and behaviors in the present, they'd say, let's focus on what you can control your thoughts and actions today.
I'm starting to see how those two approaches might butt heads, but I also wonder if there's room for integration. Because while I see the value in focusing on present behaviors, I also believe those past experiences, especially within our families, have a huge impact on who we are today.
And many therapists today are moving towards more integrative approach, combining insights from different schools of thought. It's not about choosing one over the other, but about finding the right balance for each individual.
It's like having a whole toolkit of approaches instead of just one hammer. You can choose the best tool for the job, but we're not done with the critiques yet, are we?
Not quite. The humanistic perspective also had some concerns, mainly about the power dynamics in those more directive systemic therapies. Remember Haley's strategic approach? And those techniques like prescribing the symptom or ordeal therapy, those raised some eyebrows.
Yeah, those techniques definitely felt a little edgy to me, even a bit manipulative. I can see why the humanists would take issue.
Yeah, humanistic therapists place a huge emphasis on empathy, genuineness, and unconditional positive regard in therapy. They believe clients need to feel safe and respected to open up and change. Forcing someone to do something they don't want to do, even if you think it's for their own good, can damage the therapeutic relationship.
It's like that fine line between being supportive and being controlling. Even if the therapist has the best intentions, the client might feel manipulated or pressured.
Right. From a humanistic perspective, true change comes from within, from self-awareness and acceptance, not from being told what to do.
It's interesting to think about those different therapist styles we discussed earlier. Someone like Satter, with her focus on warmth and empathy, would probably be more aligned with the humanistic approach than someone like Haley, who was all about strategy and power dynamics.
That's a great observation, and it highlights the diversity within systemic therapies themselves, but there's another layer of criticism we need to acknowledge, and that's from a cultural perspective.
Right, because psychotherapy, even systemic therapy, has historically been shaped by a very specific worldview, mainly white, Western, and middle class, and those biases can definitely show up in how therapy is practiced and who it's considered effective for.
One of the main criticisms is that systemic therapies often promote a very narrow definition of a healthy family that doesn't necessarily fit with the values and structures of other cultures.
So, for example, they might emphasize clear boundaries and a nuclear family structure, which might not be the norm in cultures where extended family plays a much larger role or where interdependence is valued over independence.
Exactly, and by imposing these Western norms, therapists might unintentionally pathologize perfectly healthy and functional family dynamics. Imagine a therapist assuming that a close-knit, multi-generational family is enmeshed simply because it doesn't fit that traditional nuclear family model.
It highlights the importance of cultural sensitivity and humility in therapy. Therapists need to be aware of their own biases and be willing to adapt their approaches to fit the unique needs and values of each family.
Absolutely. And that brings us to the final perspective we'll consider, which is the integrative perspective. As the name suggests, this approach is all about taking the best from different schools of thought and creating something new and more holistic.
So rather than seeing those different perspectives as being at odds with each other, they're looking for ways to blend them together, taking what works from each approach. I imagine they'd have some interesting things to say about systemic therapy.
They appreciate the value of systemic thinking, but caution against taking it too far. They argue that not every problem is a systems problem, and sometimes focusing solely on the family can distract from individual needs and experiences.
So while it's important to consider the context, the web of relationships,
Yeah.
you don't want to lose sight of the individual threads that make up that web. It's about finding that sweet spot, that balance between individual and systemic perspectives.
Precisely. They also acknowledge that systemic therapies, like any approach, have limitations. They're not a magic cure, and there might be times when other approaches like individual therapy or medication are more appropriate. It's about being flexible and adaptable, choosing the best tools for the job, regardless of which theoretical camp they come from.
It's so refreshing to hear about this move towards integration. It feels like a more mature and realistic approach to therapy, recognizing that there's no one right way to do things. It's about being adaptable and responsive to the unique needs of each person and family.
And it's about acknowledging that even those groundbreaking ideas need to be constantly reevaluated and adapted as we learn more about human complexity. But before we wrap up part two, I think it would be helpful to ground these criticisms in a real-world example.
Right. I'm remembering that case study of the C family from our source material. They were dealing with some pretty serious issues, and it sounds like those traditional approaches really weren't working for them.
The C family is a classic example of how focusing solely on the individual can miss the mark when the real problem lies in the family system. The mother, Mrs. C, had been hospitalized multiple times for what appeared to be obsessive-compulsive disorder, specifically an obsession with cleanliness, but her symptoms were deeply intertwined with the family dynamics.
So her compulsive cleaning wasn't just some random quirk. It was a symptom of something larger going on within the family system that makes me think about those concepts of homeostasis and feedback loops we talked about earlier.
Right.
Mrs. C's behavior, as extreme as it was, might have been the family's way of trying to maintain some semblance of balance.
Exactly. And when you look at the family through a systemic lens, those connections become clearer. The C family had a very enmeshed structure with unclear boundaries and a rigid hierarchy. The father, Mr. C, was very passive. Mrs. C was overbearing, and the children had very little autonomy.
I remember that detail about Mrs. C walking around the house with her breasts exposed, even in front of her teenage sons, that definitely suggests a lack of healthy boundaries.
Right. And her compulsive washing rituals, while seemingly an individual problem, were actually serving a function within the family system. They were a way of maintaining a sense of control, of keeping things clean and orderly in a family that felt chaotic and overwhelming.
It's almost like her symptoms were a desperate attempt to create some sense of order and stability in a family that was teetering on the brink of dysfunction. It's tragic that she ended up being labeled as the sick one, when in reality the whole family was struggling.
And this is where systemic therapies can be so valuable. They offer a different lens, a way of understanding those connections and addressing the underlying patterns. Imagine if a systemic therapist had worked with the C family. They might have used techniques like reframing to help the family see Mrs. C's symptoms not as an individual problem, but as a reflection of the family's struggles.
So instead of seeing her as the sick one, they'd see her as part of a system, someone who's trying to cope in the best way. She knows how, even if those coping mechanisms have become problematic, it's a much more compassionate and understanding approach.
Exactly. And they might also work on strengthening the boundaries within the family, encouraging Mr. C to be more assertive, empowering the children to express their needs, and helping Mrs. C find healthier ways to manage her anxiety.
It sounds like a delicate balancing act, supporting each individual while also addressing those systemic dynamics. But this case study really brings those concepts to life and shows the power of a systemic perspective. Sometimes the solution lies not in fixing the individual, but in healing the relationships that surround them.
And that resonates with the humanistic perspective as well. It's about recognizing the inherent worth and dignity of each individual while acknowledging the profound influence of those social connections.
It's all starting to click now. It's like we've zoomed out to see the whole forest instead of just focusing on individual trees. But we've covered a lot of ground today, from those glowing endorsements of systemic therapy to some pretty sharp critiques. What's next for us on this deep dive?
In part 3, we'll explore the future directions of systemic therapies, looking at how the field is evolving to meet the changing needs of individuals, families, and society as a whole.
So stay tuned as we venture into the uncharted waters of what's next for systemic thinking. Welcome back to the final part of our deep dive into systemic therapies. It's been quite a journey, hasn't it? From those foundational concepts to the critiques and even a real-life case study. We've really explored the landscape of this approach. But now I'm curious about what lies ahead. What does the future hold for systemic therapies?
Well, the exciting thing is that systemic therapies are constantly evolving, integrating new research and expanding their reach into new territories. It's not a static field. It's dynamic and responsive to the changing world around us.
So it's like those family systems we've been talking about, always adapting, always in flux, always seeking new ways to thrive. What are some of the most promising directions you see emerging?
One fascinating area is the application of systemic principles to individual therapy. Now, I know that might sound a bit paradoxical. How can you have systemic therapy without the system, without that family context?
Right. Seems like you need that web of relationships to really make sense of things from a systemic perspective. So how does that work with just one person?
It's about recognizing that even when we're working with an individual, they're still carrying their family history, their internalized relationships, and those systemic patterns within them, those early experiences, those dynamics, those unspoken rules. They become a part of who we are, even when we're not physically with our families.
It's like those early relationships provide a template, a blueprint for how we navigate the world. And sometimes those blueprints need a little updating.
Exactly. And by understanding those systemic influences, individual therapists can tailor their interventions more effectively. For example, they might help a client explore how their current relationship patterns mirror dynamics from their childhood family. Imagine someone who consistently chooses partners who are emotionally unavailable. A systemic therapist might help them trace that pattern back to their relationship with a parent who was also emotionally distant.
That makes so much sense. It's like those early experiences create these grooves in our brains, and we keep falling into those same patterns without even realizing it.
And bringing those patterns to light can be incredibly powerful. It's not about blaming your past, but about understanding how those experiences might still be shaping your life today.
Yeah.
But systemic thinking isn't just confined to therapy rooms, it's also branching out into other fields like medicine and education.
Now, family systems medicine, that one really piques my curiosity. It sounds like something straight out of a science fiction novel.
It's not about genetically engineering families or anything like that. It's about recognizing that health and illness are influenced not just by individual factors, but also by the family system. Think about it, if someone is struggling with a chronic illness, their family can play a huge role in either supporting or hindering their recovery.
That's so true. A supportive family can be an incredible asset when someone is facing health challenges, providing emotional support, practical help, and even just a listening ear. But a family that is constantly critical or dismissive can make things so much harder.
Exactly. And family systems medicine brings together doctors and therapists to address both the physical and the emotional aspects of health and illness. Imagine a doctor treating a child with asthma who also notices a lot of tension between the parents. By understanding the family dynamics, they can tailor their treatment plan to address both the child's physical symptoms and the emotional stress within the family that might be contributing to those symptoms.
That's a much more holistic and integrated approach for healthcare, recognizing that the mind and body are interconnected and that the family plays a crucial role in overall well-being. It's like treating the whole person, not just the disease.
And this trend toward integration is happening within systemic therapies as well. We're seeing less focus on those rigid schools of thought and more willingness to blend different approaches, taking the best from each to create something new and more effective.
So instead of therapists identifying themselves as a Haley therapist or a Mnuchin therapist, they're becoming more eclectic, drawing from different toolboxes to find the best fit for each client and family. It's like being a master chef who can combine different ingredients and techniques to create a unique and delicious dish.
Exactly, and that eclecticism is leading to some really innovative and effective therapies. For example, we're seeing the integration of systemic principles with cognitive behavioral techniques, mindfulness practices, and even attachment theory. Imagine a therapist who can help a couple improve their communication patterns while also teaching them mindfulness techniques to manage conflict more effectively.
It's like a superpower, being able to blend these different approaches to create something truly tailored to the needs of the individual or family.
Hmm.
It's so exciting to see how the field is constantly evolving, becoming more sophisticated, and expanding its potential for helping people.
And as the field evolves, it's also becoming more attuned to issues of diversity and social justice. There's a growing recognition that those traditional models of healthy families, often based on white Western middle-class norms, just don't fit for everyone.
We touched on this earlier with those critiques from a cultural perspective. It's so important to recognize that what works for one family might not work for another, and that imposing those narrow definitions of healthy can be incredibly damaging.
Exactly. And that's why there's a push for more culturally sensitive and inclusive approaches, recognizing the unique strengths and challenges faced by families from diverse backgrounds. Imagine a therapist who, instead of assuming a family should have rigid boundaries, helps them understand how their fluid boundaries and strong extended family ties are actually a source of strength and resilience.
It's about meeting families where they are honoring their values and traditions and working within their cultural context to promote healing and growth. This is all so hopeful. It feels like systemic therapy is not just evolving, it's becoming more compassionate, more inclusive, and more responsive to the complexities of the world we live in.
And speaking of complexity, one of the most important things to remember is that systems exist within larger systems. Families are embedded in communities which are embedded in societies and so on. It's like those Russian nesting dolls. Each one fits inside a larger one, creating a complex and interconnected whole.
So systemic thinking isn't just about families, it's about understanding those interconnected webs of influence at every level, from the individual to the global community.
Exactly. And as our world becomes increasingly interconnected, this perspective becomes all the more crucial. We need to understand those complex systems, those feedback loops, those unintended consequences if we're going to solve the pressing problems of our time. Imagine applying systemic principles to address issues like climate change or social inequality.
It's a whole new way of seeing the world, understanding those ripple effects,
Yeah.
those interconnected webs of cause and effect. It's a bit overwhelming, but also incredibly empowering.
It's humbling, too. It makes us realize that we're not just isolated individuals, we're part of something much larger, and our actions have ripple effects throughout those systems. That means we have the potential to create positive change, not just in our own lives, but in the lives of others and even in the world around us.
It's a huge responsibility, but also an incredible opportunity. It makes me wonder, what are the biggest challenges facing systemic therapies as they move into the future?
One key challenge is developing a more comprehensive and nuanced understanding of how to create change at those larger systemic levels. We've made great strides in working with individuals and families, but how do we apply those principles to transform those larger systems?
Hmm.
How do we create more just equitable and sustainable ways of living?
It's a monumental task that will require collaboration across disciplines, cultures, and communities. But systemic therapies, with their focus on interconnectedness, seem uniquely positioned to lead the way.
Absolutely. And I think that's a perfect note to end on this. Deep dive has taken us from the micro to the macro, from the inner workings of families to the complex systems that shape our world.
And I'm left with this sense of awe and possibility. It's like systemic therapies are giving us a new language, a new way of seeing, and a new set of tools to create positive change at every level. But I want to leave our listeners with one final thought.
Please do.
As you go about your day, try to see the world through a systemic lens. Notice those patterns, those connections, those ripple effects, and ask yourself, how might this perspective shift how you interact with your family, your community, and the world around you?
That's a powerful question to ponder. And remember, those resources we mentioned throughout our deep dive are listed in the show notes, so you can continue exploring these ideas on your own.
Thanks for joining us on this journey. Until next time, keep diving deep.